Now, of course, COVID-19 has accelerated the shift towards digital health and especially virtual care slash telehealth models. In this light, in this context, what do you think are or should be the top priority areas for health system CIOs in not just dealing with the current situation, but also positioning the organization for what might be coming as the future state?
Yeah, so there's always two sides to a coin, right? And COVID had a silver lining in that it got us really quickly involved in leveraging these digital capabilities, whether that was, increasing our communications through texts or through other tools with our constituents, or bringing in telehealth or just televideo to do meetings and the kind of things we're doing right now. So there was that bright side that a lot of technology got brought in very quickly and a lot of people got more sophisticated in using it. But there's the other side of that coin. The difficult side of that coin is the way we did it, because we are forced to do it so quickly, in some instances hours, but certainly in days. Doctors moved home, administrators moved home, teams moved home. And so we would deploy, and we did, because I helped create this problem, right? We would deploy just about any kind of technology to facilitate doing that. So now we find ourselves in an environment where a lot of disintegrated tools are out there that need to either be brought together or, brought to a more singular platform to really make it efficient and effective for both us as an organization providing the service and for the patients or members or families that we serve. So I think one of the big challenges right now the CIOs will be going through, I know they're doing it, so it's, this isn't novel, but is to get this kind of quagmire, this cobbled together solutions to something that is much more seamless, much more easy to maintain, secure, share data across. So I think that's going to be one of the challenges that we have as we move more rapidly to this digital age. And I feel kind of strongly about, I don't know how broadly this is shared, but you wrote the book, so you can tell me, is we're creating non-native applications to facilitate communication or data sharing with the people that we serve. And what I mean by that is, if I want to text a doctor, I end up going into an application, signing into it outside of my phone, and then I can text within this very secure environment. And I believe more and more the challenge we're going to have as technologists is not having, these separate applications, but using tools that are native to the hard, the solutions that we have in our hands. So texting would be just like texting anyone else, or looking up data is going to be, I can ask Siri about my medical record versus having to log in and into a separate application to do it. That creates challenges, but that's when it's really going to make this digital interaction, much better for those that we serve.
We hope you enjoyed this podcast. We invite you to subscribe to our weekly newsletter, The Healthcare Digital Transformation Leader. Write to us at info@thebigunlock.com with your feedback and questions.